Hi, I'm Dr. Paul Smith from Bangor OBGYN. Welcome to my educational module regarding, do I really need a C-section? Many women have that decision made during their labor process, and they don't during a process where a woman has been in labor for a long time, she's tired, there's a lot going on in her life. She can get information that is very important for that decision, but sometimes her ability to process that information right then and there isn't what it can be otherwise. So I want to cover some of the reasons that women have C-sections so that you can be preloaded with that information before you go into the labor process. So let's talk about some reasons that are related to how the baby is positioned. Some babies are breech, and that means not head first, fanny first or feet first. Now, some breeches can be delivered vaginally. I'm one of those old guys that knows how to do that. Many physicians have not been trained and cannot do that successfully, safely. And so a breech presentation is one reason. Bleeding. That can be from the placenta either in front of the cervix or deeper inside the uterus. If the placenta is starting to bleed and that bleeding is causing the uterus to contract or interfering with oxygen and nutrition to the baby, the bleeding all by itself can be a reason for a C-section. Fetal distress. The baby is losing oxygen, losing nutrition, and the baby is starting to get starved for those crucial items. That is usually manifested by the fetal heart rate that we monitor during labor, and there are some patterns that we can recognize that indicate to us that the baby is entering a fetal distress zone, and it's time to take action to get that baby delivered before that baby gets sick. Now, the whole topic about fetal monitoring is a different educational module because that's a lot of discussion. But fetal distress is a topic that is widely discussed in C-section causes. We want to make sure we take action before the baby gets compromised. The course of labor, how quickly the cervix dilates, is another one of those issues that gives us clues as to whether or not the baby can fit. So let me draw a quick diagram that illustrates for you what I expect to see as your cervix dilates as we make progress toward delivery. Okay. This is the cervix dilation. How many centimeters is the cervix dilated? There is a latent phase when the cervix very slowly dilates and it's slowly making progress toward the finish line. It's also usually thinning. This dotted line is where the baby's head is in the pelvis. It originally starts up high in the pelvis, and as the cervix finishes dilating, then the head starts coming down toward the out. And then wonderful things happen and the baby falls out. So here we are, this flat line, this slow dilation is called the latent phase of labor. Because things are slowly evolving, thinning, and slowly dilating. Once that curve changes, we enter the active phase of labor, and the cervix starts dilating more quickly. Now, there are some general guidelines that we look for women having her first baby and women who've already had a baby. And for a woman having her first baby, we want this cervix during the active phase to dilate at least 1.2 centimeters an hour. If the cervix is not going that quickly, then I want to assess what's going on. Are the contractions strong enough? Is the baby's head turned sideways and getting stuck? Is the pelvis big enough? I need to make an assessment. Now, the good news is the average rate of dilation is 3 centimeters an hour. So while 1.2 is the average, 3 centimeters is, 1.2 is the minimum, 3 is the average. And so we look for these numbers during the active phase as we're going from about 4 centimeters, ballpark, to 10. Now, for women who have delivered already, the cervix usually knows what to do. And the cervix is a little smarter. So 1.5 centimeters an hour is the minimum for women who have delivered previously. And the average is 6 centimeters an hour. So it goes a lot faster. And we then look for the cervix to get completely out of the way. So we begin the second stage of labor, the pushing stage, the work, where you start to push the baby toward the outside. Now, for first-time babies, the average time that a woman has to push is about 66 minutes, a little over an hour. Seems longer, but it's about a little over an hour. With epidural anesthesia and some of the changes in sensation and muscle strength, sometimes we budget 2 hours for that stage of labor. For women who are delivering the second time, it goes a lot faster. The average pushing time is 24 minutes. And so the cervix knows how to get out of the way, the vaginal tissues have been stretched, and that baby makes progress. These are the general guidelines we look for your cervix dilating. Now, there are a lot of factors that go into when do we stop, when do we say, okay, we're done, it's not going to go. If a woman is in adequate labor and the cervix does not change dilation for 2 hours, then my conclusion is that an arrest of dilation is a very reasonable diagnosis. Do we want to continue pressing toward delivery, or is the body telling us the baby won't fit? So no change in cervix for 2 hours, adequate contractions, and usually the same examiner. So we know the 3 centimeters for one person is 3 centimeters for another. The same criterion for women who have delivered before, 2 hours change. Once the cervix is gone and a woman starts pushing, we look for progress toward the outside. If there is no descent in 1 hour with adequate pushing, then we recognize that as a warning sign, and we start thinking that a cesarean delivery may be necessary. So there's a lot to this. There are a multitude of factors that are involved in monitoring a woman for a safe arrival of her fetus. This is a very quick, very broad brush discussion regarding some of those factors. Obviously, your discussions with your physician or midwife when you were in labor is the important process in giving you information and making a real decision that involves you and your baby. My goal today was to give you some baseline information that you can carry forward, and I hope this will be useful to you as you prepare for the arrival of your baby. Thanks for joining me.